Amaze is a member of the Disabled Children's Partnership, a national alliance highlighting the need for more central government investment in health and social care services for disabled children. This Carers' Rights Day, at our AGM event in November, we asked some parent carers from across Sussex to tell us about the struggles they face.
I got involved with Amaze because I'm actually the parent of a disabled child, the beautiful Livvy, who's now 17. She's the eldest of my 4 children. Olivia was the most perfect baby. My husband and I were in North London living our perfect lives. We had a few issues, but she was incredibly passive, which I now realise was a bit of a sign, would go to anybody. And when I look back at photographs of myself then, I just had no idea what lay ahead, no idea. And there was a whole secret generation of disabled children that we were, Livvy was about to join, that I absolutely was not on my radar at all. She's never had any spoken language. She used to say more for everything for a phase of 18 months, and then that was it. It was clear she had really severe learning difficulties. We knew that early on. At the time, I remember us driving around as a family, so I had her little brother Harry then, and we'd look out of our car window at all the families doing all the normal things along the seafront, and we didn't get out of the car. We couldn't get out of the car because it was just too stressful to contemplate. And it's not just us that have been living this secret life, but Livvy's 3 siblings. Livvy had to come first for many years, and well, she still comes first. And I couldn't go out of I physically could not go out of the house without a carer. And then we were just hit by complete devastation. So she had seizures at 5. We knew that. They were very well controlled. And then I remember she kept falling to the ground and we couldn't work out what was going on. Was it an autistic behaviour? We don't know. And she had this EEG at 10 that was just absolutely devastating. She was basically locked in a world of seizures. So fast forward now, and Livvy, it's going to make me emotional now because she really was a wild child, and she's still there somewhere, but she's on so many drugs and she has so many seizures. The true Livvy is not, she's profoundly disabled. Livvy spent long periods in hospital with seizures. So her ability to access normal life is completely dictated to by health and what's put in place for parents across Sussex with these kind of challenges. So getting support still feels like a lottery, and I have had plenty of fights along the way. Amaze have been there all the way through. It's still despite all the changes and improvements, it's still a massively complex web to navigate as a new parent. You still feel completely overwhelmed, I think. Patient and social care have actually worked really brilliantly together, and it's not been the fight I was expecting. I was really expecting to have to fight to get her respite at Chaley Heritage Foundation, where she'll be going 4 nights a week. I'm not ready for that in January. But actually it's been quite smooth, sort of, apart from me letting go, I think. We can all get annoyed at parents about the lack of services, but there's not enough money. So this needs to be looked at, which I know we'll be talking about in a minute. And I have to say as well, I'm the EHCP who was talking about that. So even though I work for Amaze, I got Livvy's EHCP done, and it was actually, I think, the worst EHCP at that time they'd seen. Didn't mention seizures. Fabulous. So sorry, local authority, for a little bit of negativity, but we did get there in the end, and she does have a really good EHCP now.